Welcome to the Startup Physicians Podcast, where we explore how doctors lead healthcare innovation. Please like and follow our show to join our community of physicians contributing to meaningful change. Hi, everyone. Welcome back to the Startup Physicians Podcast. This is your host, Dr. Alison Curfman, and I am joined today by a friend and colleague, Dr. Alex Mohseni, an emergency physician who has a very interesting career path and a lot of different things he's done along the way, a founder and a fellow entrepreneur. So, Alex, thank you so much for joining me today. I know you're traveling, so I appreciate your time.
Amazing, Alison. I'm so excited to be here. And this is one of my favorite topics. It's just, how can physicians advance their careers?
That's awesome. And every time I get started talking to my guests before we start recording, just for those of you who are listening, I share with them that the goal of this podcast is to really inspire you. I want everyone listening who might be commuting on your way to a traditional clinical job and trying to think outside the box about, what else could I do with my career? I want you to hear the stories of people who are just like you, who are physicians, practicing medicine, raising kids, doing all the things, who have taken a different path. Because I think a lot of the reasons why people don't take a different path is because they don't know it exists or they just don't know how to find it. So with that, I would love for you to start, Alex, with just a little bit about your clinical background and how you got started on the path that you're on today.
Thanks, Alison. So emergency medicine by trade. I trained at Jefferson and joined a local ED group in the DC area. Back then it was called the EMA. And I had no idea what I was doing. I was like, whatever group I join, I'm probably just get screwed over. So, so I joined the first group that gave me a job. And we were just in this is like 06, 07. We were just in that era. We were transitioning from paper charts to EMR. And I figured out how to export the metadata out of Meditech, as many of you may be familiar with that hospital EHR system. And I started creating performance reports on our physicians because back then we were paid on a pure hourly basis. And I found it really frustrating that some of us were seeing twice as many patients as others. Others were just ordering a bunch of MRIs on their patients and blocking their pod or whatever. All sorts of games that the physicians play. That was kind of my initial thing. And I started feeding these performance reports to my bosses. And it really kind of sparked a transition for our entire practice to switch to an RVU-based model, which improved our productivity, improved our profitability. And I kind of worked my way up to eventually becoming the chief innovation officer of our group. And I did a lot of work on, I would say, back-end office improvements. So a lot of like claims denial processing and things like that. And I had actually, so to go to your message, Alison, that you can just do stuff, I had zero formal training in any of that sort of stuff. I had never read a book. I'd never read an article about this. But the one thing I brought was just a problem-solving, mentality. And I'd love to share like an anecdote of like just an example of what that was. Like I had just watched, those shows, like those repo shows where they're like somebody hasn't paid their car bill and they go and repossess the car, right? So I was just like fascinated by that. And I had been watching those shows. And right around that same time, my boss came to me and he said, Alex, go in the back office and just figure something out. Like that was the directive. Okay. So in our back office at this time, we were relatively large. We were doing about 1 million patient encounters a year across 25 different ERs and programs. And so we had about 100 back office staff. And so just like the scene from Office Space, I went to the farthest corner, the dark corner, and there was a gentleman sitting there and he had envelopes stacked from the floor to the ceiling with the little yellow stickers that says it's a wrong address. And I introduced myself. I said, so who are you and what do you do here? And I remember he's like, well, my job is to take all of these invoices that we've sent patients for the patient responsibility and where we've gotten the bad address. And my job is to like call the patient and ask them for their correct address so that we can bill them. And I just started laughing. I said, are you serious? And I looked at this. There were thousands of envelopes. I said, is this a year's worth of bad addresses? He's like, no, this is just what we got this week. And it blew my mind. The amount of money that was sitting there uncollected was unfathomable. And so I asked him to kind of do one of these encounters. And of course, the patients all just hang up. Like, they're not going to give you their correct address,
like,
right?
Hey, can you give me your address so you can owe me things? Like, let me find you.
It was nuts. And so I had just watched the repo show and I thought there must be some software that these folks are using to get the correct address for people. So I was like, stop what you're doing. I went to my desk and I found this credit software where basically, as long as you're allowed to, which we were as a medical practice, you can put in any information you have about somebody, like what you think their name and address and all that is, and it will show you the matching profiles. So we were able to move to, like, this was $50 a month. I'm not exaggerating. That's all this software costs. And we were then able to use this software to get the correct addresses for all these patients and completely change our billing practice. And again, like, I didn't know anything special. I wasn't trained. And we had like chief financial officers, we had people, billing managers, all this sort of stuff. But just like, so my message is like, you can just do stuff, especially in this day and age where you can figure anything out with AI, right? You can just start solving
You'd have
problems.
like, hey, you are a tech expert, or you are a strategist or a marketing strategist, whatever. It's great for brainstorming solutions.
So I did all sorts of projects like that. And eventually.
And you were still like employed and more of a traditional, like, employed W-2 doctor at that point?
I was employed W-2 physician, but as I picked up more of these projects, my clinical hours were going lower and lower. And that kind of has its own dynamic, which, especially in emergency medicine, I feel like in some specialties, as you work less, I think it's okay. In emergency medicine, I think it becomes really difficult because you start to lose the kind of edge on your skill set. And I could sense that. And the more I did non-clinical stuff, the more I really enjoyed it. It was so much fun for me. It was just like problem solving. It's like a puzzle, right? So then I built out a telemedicine division for us. I got us contracts with a local Medicaid MCO. And then we sold to private equity.
Like, people are like, well, yeah, you make that sound so easy, but like, I don't know how to get contracts with Medicaid MCO. Well, the point is, we know how to figure things out.
Yes.
You didn't know that either. I didn't know that. I never knew how to make, payer contracts, but you ask people, you create a problem statement, you figure out what it is you're trying to figure out so that it's really clear, like, what is the problem I'm trying to solve? You say, like, who could help? What are the pieces of the problem? Who could help me with that piece internally? You talk to them. They say, well, this is who you need to talk to externally.
Yeah.
And if you're capable of setting up a meeting and having a conversation, it's like having your own little discovery process. So I think people hear something like that, like, oh, I went ahead and set up contracts with the MCOs. They're like, oh, this guy's already on a different playing field than me. I could never do that.
I had never done it before. Right?
But you know what you have done before? You've had someone come in with a weird problem to the ER and you've been like, who should I call? I'm going to call a consult. I'm going to ask someone who knows more about this than I do. So like, that's just my point about some of these translatable skills. Like, you are trained for decades of your life in problem solving and like seeking a solution. We know how to do this inherently. And I think people don't understand that that's actually a skill set that a lot of people don't have.
Yeah. I think what's really tricky for folks is I think medicine selects for people who like a very linear path in their career. And so we're selected for that and we optimize ourselves for that. I have to take this MCAT test and then I will be successful, right? Like our brains are wired for that for like a decade while we go through this, if not more. And then all of a sudden you're thrust into this environment where there's no more linear path. And you have to just kind of figure it out. And for a lot of people, they freeze. They don't know what to do. And one of the things I've been hearing a lot of folks say on Twitter lately, which I really love, is some version of like, when you're not sure what to do, just start doing something, because activity generates data. And then from that data, like, you can now have something to build. So you start doing X, it doesn't work. Okay, well, that didn't work. Well, let me try doing Y, right? Just start doing something. And I think when you think about, well, what should that something be? The way I always approach it is, what can I do that provides value for somebody else? If you take that approach, you will generate a good reputation. You will create new relationships. And those relationships will be of value. People will see value in you. And for me, like, that single approach has really worked well for me.
Yeah. I mean, I think it's like such a life lesson that it's shocking how many adults don't learn this, because I do this with my kids. I'm constantly trying to teach them how to turn the angle around and look externally. Yeah. And instead of being so focused on like, what do I need? What do I want to get? What do I need out of this situation and more like, how can I contribute? What's the value I can bring? How can I support someone else? And I think that the problem is that a lot of us have like a scarcity mindset that like, oh, if I do that, it'll be giving away my secret sauce, or it'll be like it won't come back to me, or I'm gonna be taken advantage of because I'll be doing something for someone and they're not going to be doing something for me. Honestly, like we will get into later in this podcast what you're building right now, but there's a lot of people that would look at what you're building and what I'm building and they'd be like, don't associate with him. He's going to be your competition. Like, I don't think that way. We're building like similar things, but I think that if someone would benefit from what you have to offer, I'd love for them to know about it, because I just feel like the people that want what I have to offer will be drawn to my energy and they'll join what I'm doing, and the people that want to do what you're doing, that's great. I don't consider myself to have any competition actually. But when you're thinking about like, how can I provide value for someone else? How can I create something new that didn't exist before that can be really beautiful and helpful in this world? It makes it so much less about you. And I really, truly believe in like the law of attraction, that it'll bring more things to you if you're willing to be others focused.
Yeah. And it's simple math. Like I basically go with the mindset that for every 10 times that I go out of my way to do something for somebody else without thinking, what am I going to get for it in the short term? Like just put that aside and leaving myself vulnerable where they could take advantage of me if they wanted to, right?
Mm-hmm.
I basically accept the fact that maybe 1 out of 10 times I am taken advantage of. And it may happen, but the other 9 out of 10, I get something that's out of the world, like amazing. Yeah.
Yes. Some level of connection or some other value, or yeah.
And
absolutely.
that's okay. That ratio is unbelievable. So I want to share a story of like in real life, how did I do this? So when I was building the telemedicine program for our ER group, I had to choose a technology platform, and there was a text-based telemedicine platform called SiriusMD back then. And so back then they were just a technology platform, and they needed physician group like ours to actually staff the platform, and they had contracts with certain payers. My group was maybe the first or the second group to partner with them, and I invested a massive amount of time like helping make our partnership successful. And I had no equity in SiriusMD or anything. And I gave a lot of feedback, helped them improve the product, all sorts of stuff. So then once we sold the emergency medicine practice and I left after that, within a couple of weeks, the folks at SiriusMD called me and said, "Hey, what are you doing? Stop vacationing. Why don't you come join us as a physician leader and help us build our own medical practice?" And that is what I did. So if you provide value, like people will notice and people will want to work with you.
And that's what I teach people in my course too, is just like constant outreach and providing value. Walk around at conferences, talk to all the vendors, tell them all the
Yes.
ideas you have about their product and how they could make it
Yes.
better and how they could grow their footprint, and just be a blessing to the people around you. And it will draw so many people to you for paid opportunities. And I don't care at all if I'm giving people free advice. Like I do it constantly all the time. And I'm constantly asking like, oh, how can I support you? How can I connect you? But I think that abundance mindset of
Yes.
like not being scared of getting taken advantage of actually projects this amazing confidence that actually prevents people to take advantage of you. And you get good at assessing like where your boundaries are, and then you recognize like how you're going to operate. And I think that we've barely scratched the surface of your career journey, but I think that this is such an important concept about the mindset and the very outward focus that you have to be successful in this space, and that you don't have to have a lot of experience doing this. You have to have the right attitude. And
That's right.
you all have a background as a doctor, so you've got that covered. Get the right attitude and recognize that there's so much to learn, there's so many people to meet, and the opportunities are endless.
And be curious, right? Like I knew as a physician that I didn't, like in my early days, I didn't know anything about business. I didn't know what is a pro forma, how to create one, how to read one. So be curious, be humble, go out there. Like it's never been easier to learn. Like there's no excuse, you know?
Yeah, absolutely. So you moved into this like startup space as a physician, and then what happened?
So I worked with SiriusMD for a while. That was one of the best experiences of my life. Like working with a startup in the kind of, I would say, early mid stage where the team is like fewer than 50 people, and is an unbelievably fun experience if it's the right team. And this was like I love these people. Like to this day, like we still, many of us still text each other, and I consider many of them to be almost like family. So I worked for SiriusMD, and then so I think there's another actually interesting lesson with the next thing that I did, which is I worked for a remote patient monitoring company. And the story there is, so I was like a medical director or CMO type person for them. So I think one of the things that physicians should think about is how to use regulation and policy as a way to figure out where is the puck heading? Like, where should I invest my time? So in November of 2019, Medicare announced the new RPM codes, and they would finalize them in, I don't know, October or November of that year. And if you actually spent a little bit of time reading about the RPM codes as they were structured at that time and thinking about the financial implications, you would understand this was one of the first times, if not the first time, that CMS had created a program where primary care physicians could essentially outsource the work of a CPT code, which was outsource the work of RPM, but bill for it themselves in a way that would not replace their current income. It would add to their current income. So from a just pure financial modeling perspective, it was the first time that PCPs could make an extra $100K a year, assuming medical necessity and all of that is met. But that had never happened before. So for me, the alarm bells went off that, wow, this is going to be a huge opportunity. There's going to be a lot of companies chasing this space. I want to find the best company for me to work with. So how does one do that, right? So that you don't go on Indeed or LinkedIn. Like, that's just not like...
No, and most of them they don't have a job or an advisory role posted. You
Exactly.
go make connections, you find what you're interested in, you connect with people that are doing that, you offer them value, you develop a relationship.
That's exactly right. So what I did was I started calling every RPM company I could find and just trying to understand, how do you do RPM, right? And a lot of them were like, the patient checks the blood pressure and then we fax the result to the doctor. I was like, okay, no. Like, no, I need to find somebody who's really doing this well. So eventually I landed on the Athena Health Marketplace. And there's a lot of vendors on Athena. And I found one RPM company listed there that said that they're fully integrated into Athena. I was like, oh, interesting. So here's an RPM company that's actually invested in tech and be integrated and all that. So I called them up. They were called AccuHealth. And our 30-minute meeting turned into 3 hours. And it was just me grilling them nonstop, because the more I asked, the more I learned, oh, wow, these guys are like really tech savvy. And I had not met anybody like that. And they were hungry. They were smart, and they were not clinicians themselves. And they didn't have a clinician on their team, like a physician leader. And at the end of that meeting, Steve, the CEO, turned to me and he's like, Alex, we've never had anybody ask us so many questions. We need a medical director, it seems. Do you want to be our medical director? And that was it. And I said, yes,
Yep.
like on the spot.
Startups have no level of hierarchy or bureaucracy or like a committee needs to meet.
No,
it's
exactly.
like, hey, this is aligned. Let's like take this opportunity in front of us. And it's just like so refreshing when you're coming out of like traditional practice to be able to connect on a creative level. And like I just don't think that I've ever heard anyone in traditional practice talk the way that founders talk.
Right.
There's an urgency, right?
Yes.
And an excitement. Like, these are people that probably quit their job and didn't take a paycheck for a while because they care so much about what they're doing. And they have a very limited runway. They know exactly how many months they have before the business goes under. That's the phase of startups. It's like, we have this much runway to figure something out. Let's do it now. When should we do it? We should do it now. And there's no bureaucracy. And it can be such a fun phase to be an advisor or a medical director. And again, it does, like, being in the trenches with these people, it does form these relationships that they are like family. Like, and you will carry those relationships forward for a very long time, especially if it's like the right team. And it sounds like you went through a bunch of conversations like, oh, okay, cool. They're building something that's not quite aligned with me. That's not quite aligned. And oh, I hope they do well. And then like, bam, green light. This is the one. Yeah. It's almost like dating. Not that I've dated in the past 2 decades, but it is like, you got to talk to a lot of people to find the ones that are right for you. But if you only have one conversation, you're not going to find it.
And take the approach of creating the opportunity. Don't
Don't wait for it
Don't
because it's
wait
not
for
going to
it.
come to you.
So
Yeah.
like I had a friend who was an OBGYN who was trying to figure out how to get in the startup space, and she was not having any luck on like the Indeeds and the LinkedIns of the world. And I said, well, let's do a completely different approach. Let's go find every startup that's in the maternal fetal medicine space out there. Okay. And then there's some tools you can use out there. So one of them is called exa.ai, where you can do semantic search for companies. That's a tool that I suggest everybody go explore. And so we did that, and we found like 20 different startups that are in the OB-GYN, maternal space. And then I said, okay, now for each of these, go find them on LinkedIn, find all the people, go connect with them, and just start having conversations. And one thing led to another, and eventually she got a role like that. So like you can take that sort of approach.
This is exactly part of what we do in my Launchpad course. So a lot of people really need to start by identifying what it is, who they are, what they want to contribute to, what are the problems they see that their patients have that they want to work on, because you want to be contributing to things that inspire you. Like, I don't want to work on tech platforms for some sort of like arbitrage for supplies or, supply management. Like, that just doesn't inspire me, even though like those opportunities might exist for a doctor. I know what things that I see kids suffer from that I want to fix. And so if you start with this core, like, what are you focused on? What are you experienced in, and how do you want to make the system better? I actually work with people to get like a really detailed like values statement that we can use as like how you introduce yourself and how you create your services and how you really describe what sort of value you can have. And then I have an entire AI process that people have access to in this Launchpad, that what they end up with is like a very personalized custom playbook to their own goals, their background, what they're focused on, and an outreach tracker of like we've actually identified like 40 or 50 companies that you could add value to, and here's like the exact wording to use.
Yeah.
Here's exactly who to reach out to on LinkedIn. Go do it. Like, let's.
Yeah.
And it's like, if you just go through that and you have those 50 conversations, I could practically guarantee that at least one of them is going to be like, a great fit. So it sounds like we have very similar processes that we recommend.
Yeah. And imagine you reach out to all these folks just to connect. You're not even like pitching them on anything, right?
Yep.
You just connect, and most of them are going to say yes. Then start writing some content on LinkedIn. And because you recently connect with them, they're going to see it. And that content should be focused on this topic and show your expertise, show that you have a perspective, show that you're thinking about this on a higher level. And oftentimes that will lead to them reaching out to you.
It will. And honestly, like, I tell people that what makes you stand out is that you reached out. It's not that you like published in Science and Nature and you're the chief of blah, blah, blah at Harvard or anything. Like, that's great if you are, but you could just be a doctor who has opinions on things and you're engaging and engaged, and you reach out to them and say, I'm a pediatric ER doctor. I am so interested in what you're doing with blah, blah, blah company. I see patients that struggle with this all the time, and I think what you're doing is amazing. I'd love to be connected with you and hear more about what you're building. Like, as a founder who has had people reach out to me that way, I set up time with those people. I'm like, wow, this person's like interested in what we're doing, and they may have like some really great expertise. But I think that what physicians need sometimes is like hand-holding along that process, because they're like, I don't know if I should reach out, or what if they ask me a question back that I don't know the answer to? I think that you just have to, as soon as you start doing this, like, you get comfortable with it and you realize these are just people. Like, they're not scary. Like, even venture capital, like,
especially
they're not
venture
scary.
capital.
They
so like,
love connections.
I want to add on the VC side. So I'm an LP and an advisor in a fund. And so I see a lot of pitch decks come through, and I look at the advisors for these, and it's healthcare only, right? I look at the list of advisors for these companies. And if all I see is vanity advisors, where it's like Harvard, Stanford, whatever, for me, that's actually a red flag, because the academics live in la la land. The real medicine, I would say, is being practiced in the community.
Don't be offended if you're listening to this and you're an academic. You're very, very valuable.
You're so welcome to continue listening. But my point is, the community docs are the aggregate N of community doctors is way higher. And that's where these startups live or survive or die, is can they actually go and sell to the community, right? And if you are in the community, you have experience and insights that can be so valuable about how to actually sell into this, into this set of buyers, how to
Right.
implement it, how to do the change management. Like that's where these things
Because
die.
they know, like,
Yes.
what does my day look like? What is my
Yes.
staff not like? Who are the key people that at an office, at a private practice
Yes.
office, would need to have buy-in for this solution to
Exactly.
be adopted? I had one dermatologist that I worked with who was really passionate about like early diagnosis of skin cancer and like early diagnostics and like how can we improve the prognosis of people's oncology journey by catching things earlier. And she had a private practice, and we built out this entire roadmap for her of like 40 or 50 companies that she could reach out to that and her unique value proposition, which a lot of it had to do with like giving the perspective of a private practice dermatologist who is going to be the clientele that either makes or breaks the startup. They either are going to succeed or they are not, depending on how well they understand how to connect with those people. The other thing is if I reach out to any doctor's office, any hospital system, like the chances of me being able to get a meeting with anyone is like extremely high. Like I could just network with doctors I know and be like, oh, hey, like who should I talk to? For a startup founder, if they just cold outreach, like a lot of times they cannot get a meeting with these people. And so some of your value comes from like working your connections to just foster conversations. And hopefully, as we're describing this, it's sounding a lot less intimidating to people that they could truly add value to companies that are solving the problems that they legitimately care about solving, that you would love to be a part of solving. And as we're wrapping up, I would love to leave time for you to tell a little bit about what you're building with ClinX Academy now.
Yeah, so I am the founder of ClinX Academy. So that's spelled CLINX Academy. So it's the name implies like a clinician who can do X, which is anything, right? So my idea is that you can do anything, especially in this day and age with AI. There's really no limits. And our particular focus is the training that physicians need in order to become like chief medical officers and like higher level medical directors, where it's not just like managing clinicians, it's actually helping run the business, right? And in order to do that, I think you have to have a deep understanding of the regulatory, operational, financial world of healthcare. And this is what we're not trained on, right? Like, how does Medicare Advantage work? How do delegated medical groups work? What are all the various flavors of ACOs? And why does that matter when you're trying to sell into them? Prior to this, I was at Optum for a couple of years, and my team helped manage a lot of there's something called the Optum Innovation Fund. And so startups would be pitching us all the time, trying to get some funds for us. And so when you're listening to these pitches as like an executive of a large either health plan or risk-bearing medical group, if you can tell instantly that which startups understand your business model and which ones don't. And if they don't understand your business model, it's impossible for them to succeed in selling you. And it was so common that they had no idea how Medicare Advantage works, how delegated medical groups work, how risk adjustment works. Like they simply don't understand. So anyway, so we are filling that gap. If you want to be at that sort of high level, I think the only way you can get those roles and succeed in those roles is you really have to understand that content. And then you need also a network of folks who can help provide introductions. I think it's very rare to be able to get into one of those roles simply based on like applying through an online job. Like you typically need to know somebody and have a warm interest. So we try to provide that sort of community as well.
That's amazing. Well, I think that is such a great opportunity. Don't go get an MBA, guys. Like, seriously, let's do it faster. Like, all this stuff is happening now.
That's right.
By the time you finish an MBA or find an MBA and save up the money and figure it out and like, don't do that linear thing. Go do one of these programs now. Do the Launchpad program or do the ClinX Academy. If you're really looking at more of like, I want to lead a medical group, I want to get involved with a startup at a high level leadership position. You don't need an MBA. If you have an MBA, great. But do you really understand the ins and outs? I have an MBA and I didn't know anything about risk contracting. Yeah. I learned it at the firm.
That's right.
So if you really want like a get started quickly guide and like leave a program ready to go find a role, I highly recommend the ClinX Academy. We do have a discount code available, so we'll put that in the show notes. Use the code Alison with one L for a discount code, and we'll also put the website in the show notes. For anyone who's listening that wants to connect directly with Alex, he is super open to connections. Obviously, both of us are. We love supporting physicians in their journey. That's why we're doing this. Like, I don't think either of us needs to be doing this. I think we're both like involved in, I have like 25 jobs right now, but like my passion is helping physicians see this, because I think that we have a very, very important role to play. I think technology is moving faster than we've ever experienced. There are going to be some really, really important needs for physicians to bring their clinical expertise to the quality and safety of what is hitting the market. So now is the time. It is an urgency. Join the communities, join the courses, whatever you need to do, and recognize that literally the skills you have right now are in high demand. And if you are driving to work and you got to work, stop and question, do you want to be at work anymore, or do you want to be creating something? So we'll put Alex's LinkedIn in the show notes as well. I think that's a great way to connect. And do you have any ending thoughts, Alex?
Yeah, I do want to say one last thing, and that is a big kudos and appreciation to you, Alison, and what you're doing with Startup Physicians. I want everybody to just think of one thing, which is if you are waking up every morning with dread, it doesn't have to be that way. I've been there. I'm sure many of you are in that sort of situation. And prior to this, I was joking with Alison that even though I don't work clinically anymore, I still have nightmares about being, working clinically. And it doesn't have to be that way. And working with a startup like Alison, helps folks learn how to do, is one of the most fun and rewarding things you could do. It's some of the most fun I've ever had. And I think there's nothing better in life than being able to wake up with excitement for what you're about to do. And you deserve it. You've worked so hard. So you've done all this work. Now do this a little bit of extra so you can actually enjoy your life. Like, what's more important than that? I don't even know. So thank you,
have
Alison.
so many hours in the day and years in our lives. I mean, it's just like, it is so important. There is nothing more important than our time. And I feel like you and I are like feeding off each other. We're like cheerleaders. We're like, you can do anything. And anyone who's like feeling uplifted listening to this is legit. Like, we are like legit founder energy. This is what it's like to work with people in the startup world, because we're all visionary. We're all incredible optimists and really feel empowered. And it's not like it's all sunshine and rainbows, but I do certainly feel like I get a lot more sunshine and rainbow energy from the startup space than I do from the traditional space. So even if you just want a little bit of sunshine and rainbows to do on the side, definitely reach out to Alex or I, and we'd love to support you on your journey. Thank you, everyone, for listening in, and I will look forward to seeing you next time. Thanks, Alex.
Thank you.
Thanks for listening to the Startup Physicians Podcast. This community was built for doctors who want to contribute to the future of healthcare. We offer support for physicians who are ready to make the next step towards building the career they've dreamed of. Visit startupphysicians.com to learn more. And if this episode resonated with you, share it with another friend who needs to hear it. Let's change the future of healthcare together.